Good afternoon and welcome to the City Club. My name is Susan Alcorn, a member of the City Club Special Programs Committee, and we're happy to see all of you here this afternoon. The City Club serves as a place to discuss issues, problems, and solutions. And the topic today and the title is The What, How, and Why of Life's End, Moral versus Legal Dilemmas. Our program today is an outgrowth of an earlier program we had on Friday, December 6th, when we had Barbara Coombs Lee, president of Compassion and Choices, a national organization dedicated to protecting the rights of the terminally ill, including choice and comfort at life's end. The issues we face today can be extensive and complicated. Death with dignity and compassion. That's what we all want. There can be moral, ethical, and legal issues we need to understand for informed decision-making at this time. I would now like to introduce Eric Kodish, MD, and Chairman of the Department of Bioethics, the Lerner College of Medicine at Cleveland Clinic. Dr. Kodish is the F.J. O'Neill Professor and Chair of the Department of Bioethics at Cleveland Clinic. Prior to joining the clinic, he was founding director of the Rainbow Center for Pediatric Ethics. Dr. Kodish earned his medical degree from Northeastern Ohio University College of Medicine and completed medical ethics and pediatric fellowships at the University of Chicago. We welcome Dr. Kodish, our moderator for today's program. Eric.
Thank you, Susan. Medical ethics may not always provide the answers, but it must at least be sure to get the questions right. In our day-to-day ethics consult practice at the Cleveland Clinic, we do nearly 300 consults per year, and there is a lot of gray and precious little black and white. So as it is, we struggle with vexing moral questions about end-of-life care. What is the real difference, if any, between killing and letting die? How should physicians and other healthcare professionals think, and more importantly, act when confronted with challenging dilemmas? Is there an important difference between physician-assisted suicide and active euthanasia? How do we measure quality of life, and from whose perspective? Should cost ever be a consideration as we move toward health insurance reform? And if so, how and by whom should limits be set? In a tolerant and respectful society that embraces diversity, and diversity of both religion and culture, where do we draw the line? It's my honor to serve as moderator for today's panel as we grapple with these and other very profound questions. I will begin by introducing each speaker, who will provide about 5 minutes of preliminary comment. We will then move to a panel discussion. And finally, we'll open it up to questions and comments from you in the audience. Our first speaker is Dr. Stuart Youngner. Dr. Youngner is the Susan E. Watson Professor and Chair of the Department of Bioethics at Case Western Reserve University. He received his MD from CWRU and completed his residency in psychiatry at University Hospitals of Cleveland. He has a long-standing interest in end-of-life issues and is currently editing a book on euthanasia in the Netherlands. Thank you, Stuart.
Well, it's a pleasure to be here. It's a special moment because Sarah Palin's been in the news a lot lately, and here I am on a death panel. See? So, one of the few good things about getting to be 65 years of age is that you actually live history. And I've lived a very interesting history in medicine, because when I was in medical school was the time when the first intensive care units opened, and medical technology, especially end-of-life medical technology, ventilators, dialysis machines, etc., came into being. And I remember working in the first intensive care units at university hospitals. And patients and families and health professionals were faced with patients that they could keep alive, that they could never have kept alive before, and began having the experience that it didn't always seem like a good idea to keep them alive. There was a time before that, and maybe some of you remember, there was, on movies and TV, there was always a time before death when the doctor took the family into a room and said, "I'm sorry, there's nothing more we can do." And it was sort of a time of acceptance, and then the death came. But we can't say that anymore, because there's always something more we can do. And the point that I want to get across this afternoon is, I think, a pretty profound one that underlies all this discussion. It doesn't answer the questions, but I think it's an important insight. And that is that today in the United States, the vast majority of deaths occur in settings where the intervention of technology is possible. And even at home, 911 isn't far away. So that there are choices that are made in almost all deaths about whether to extend life or not extend life. And it's a responsibility and a power that we just never had before. And I'm sure as I talk in this room, even with the younger people over at the table there, everybody's had somebody in their family, grandmother, aunt, spouse, who's been in that situation where we have to make this decision. In a sense, the timing of death is in our control. And we can say, well, we have to do everything, but that's a decision too, or we're not going to do anything. So in this interim, I think our society, with clear exceptions, has accepted the notion that sometimes there are states that are worse than death, and that death is the least worst alternative. And having accepted that, then we have to struggle with the idea that in some way we, as health professionals, family members, or ourselves, are going to make a decision about the timing of death. And we don't like, it's an uncomfortable decision for most of us, and it's a decision that can make us feel like we're maybe doing something wrong. And the more active what we do, and the more clearly connected with the death, the more uncomfortable we tend to be. So turning off a ventilator, for example, where the patient dies right in front of you, is considered in law and practice passive euthanasia, allowing somebody to die. But I can tell you that it's much more difficult for the people involved than, say, writing a DNR order or making a decision not to give antibiotics. So these are the struggles. Our society has accepted just about everything in a general sense, although with Terry Schiavo you saw that you could stir up ideas that, for instance, you shouldn't stop fluids and nutrition ever. And we're right at the edge in our society where there's not much further we can go before we start. The next step would be active euthanasia, which our society has generally refused, although physician-assisted suicide is now legal in 2 states. So I think this is, in all the decisions we make, this notion of control is one that's troubling, and some people don't have any trouble with it. Most of us do. Thank you.
Thank you, Stuart. Our second panelist is Dr. Dolores Christie. Dr. Christie is the Executive Director of the Catholic Theological Society of America. Although she did graduate work in biology at St. Louis University, she received her PhD in Roman Catholic theology from Duquesne University. In addition to teaching, lecturing, and writing, she is an experienced ethicist, currently serving on the Ohio Solid Organ Transplant Patient Selection Committee.